Hello, and thank you, everybody. I'm not going. I don't have a lot of PowerPoints, and I thought I would give a little bit of an update about the vaccines, the two. Then there's a new one coming out, and then open it up for questions from everybody. Um, I'm an infectious disease physician. I mostly see patients in the clinic and around in the hospital, but I've been asked back in October, at the end of October, to help head up our COVID vaccine effort at the University of Michigan and at Michigan Medicine. So currently, we've given about 60, almost 70,000 vaccines. Uh, Unfortunately, for the last 2 to 3 weeks, we've only been able to give second doses of those vaccines. The two vaccines that are out right now include these two classes of vaccine called mRNA vaccines. One is from Pfizer and one is from Mrna. Many of you out there have already gotten those. These two vaccines are very safe and they're extremely effective, about 95% effective. There's a new one coming out now called Johnson and Johnson. It's a little bit different the way the vaccine works, but it essentially does the same thing. It protects you from getting infected and getting symptomatic and getting sick when you come into contact with COVID-19. So we're waiting today. The FDA, or I think it was yesterday, the FDA said that they approve it, the committee, and now it's going to go to the CDC, and probably by mid next week, we will be starting to give that vaccine also. It's not clear if it's only a one shot. The Mrna and the Pfizer vaccine are two shots, as many of you know. The Pfizer shot is separated by 3 weeks and the Mrna by 4 weeks. This new one coming out is only one. There may need to be a booster in the next year or so, but most people are just going to get one dose. It has been shown to be 66% effective overall, which on the surface looks worse than the other two vaccines, but it is very effective. None of the patients died, and very few had severe disease. So it was 85% in preventing severe disease. So it's very similar to the two vaccines we currently have been giving, and I think it will be a great addition to the vaccine program that we have, as well as the one the state has. They're very safe too, these vaccines. The Pfizer and Mrna, the biggest side effects have really been site injection pain. Almost 80% of people get that. Some people get muscle aches. I got muscle aches after my second dose. Very few people will get fever, and most of this occurs with the second shot, not as much with the first shot. Currently, at the University of Michigan, we're still finishing up with our healthcare personnel at the hospital, and we're also vaccinating our patients who are over the age of 65. It started out quite fast to get our healthcare workers vaccinated, but then the pipeline for the vaccine slowed down a bit, as many of you know. Hopefully, in the next month and a half, 2 months, we're going to see increases in the vaccine delivery. And so the prediction by Anthony Fauci, who is my guru for sure, is that we will probably see, we may even see more supply than demand for vaccine by the end of April, early May. So the spring will bring many things, nice warm weather, and hopefully much more vaccine for everybody. I will stop there and answer questions. I know there are questions related to the vaccine's efficacy, the new vaccine, the priority categories in Michigan, but I wanted to leave that open and see what you all were most concerned about, and I can answer those questions. So I'll stop there and take questions right now. Are there any questions about the vaccine?
I have a question.
Yes.
I find it difficult to register fast enough to get scheduled for. I got the call to say that I could register, and when I did, there was nothing left. They said try again later. So
Yes.
how do you get there fast enough? I mean, as soon as I
Well,
got the notice, I did it.
I know it's very difficult. What happened and this is at Michigan Medicine, is that correct?
Yes.
Yeah, and what we do is we send out tickets to people who are eligible and who fit the criteria, and then those people are allowed to make an appointment. We send out many more than the appointments that we have, just because we know that people aren't going to sign up. And so the problem is a lot of those, we're going to get first dose vaccines this week for the first time. And so as soon as those slots open up, they were taken up. So it doesn't mean that you won't be able to get a vaccine soon, but it means that for the moment, you'll have to wait till the next round of clinics open up. We should be getting a more reliable first dose series of vaccines. So hopefully within the next couple of weeks, you'll be able to get in. So I'm sorry that that's happening, but unfortunately it's happening to a lot of people. And it's just the way that we're scheduling. It can be frustrating, I know.
Well, actually, I got my notice on an email. So should I wait for something in the mail?
I'm sorry, I didn't hear the last. You got your notice on an email.
Right. And
yeah.
You just said you sent out tickets. So I'm not.
Yeah, no, I'm sorry. It's not. It's an email. That email allows you to be able to schedule at some point. So just keep checking into that email, and you ought to be able to get a appointment at some point. And the other way to go, there are many other places. So what I tell people right now is apply to as many different areas. There are the pharmacies that are giving vaccines. There's the local health department. We're working with the health department, and you may be able to get a spot at the health department before you do with us, because they're getting more of the vaccine at this point too. So keep trying. You will get a vaccine soon.
Okay, I have a question, Doc.
Yeah. Okay. Oh, you went out. Sorry.
Can we ask everyone to type their questions in the chat? Mrna's going to go ahead and take care of the question and answer.
Yes, please do that. So one of the questions that I'm looking at here, Dr. Hill, type your question in the chat and I'm going to get to you, I promise. Why is, this is about the Johnson & Johnson vaccine. Why is it just one shot and why does it look worse at 66%? How's that going to help? Can you speak a little bit about that?
That's a good question. And I'm just looking at the data. Actually, before this conference, I was looking over that data. It's just, I think 60 for the cutoff at the FDA is 50% effectiveness. So they feel that any vaccine that is 50% effective will be good. Now, 66% efficacy means that it is a little worse in terms of overall efficacy. But if you look at the people that ended up in the hospital, so it was 85 to 90% effective for people who ended up in the hospital, meaning very few people did. And nobody died in the group that got the vaccine. So the vaccine efficacy for mortality was 100%, the same as it is for Pfizer and Mrna. So when you look at the efficacy of these vaccines, don't only look at people. It prevents getting symptoms, yes, but what you're looking for, does it prevent me from going into the hospital? Does it prevent me from dying eventually? And the answer is that the Johnson & Johnson vaccine is about as good as Pfizer and Mrna for doing that. So yes, you have to dig a little bit into it. Unfortunately, you're not going to have a choice. If there are many vaccines at one place, they're going to set you up to get, when people are signing up for us, it depends. If they go to Brighton Health Center, they're going to get Mrna. If they come to the university and at the stadium, they're going to get Pfizer. So it's very difficult to predict, and you can't ask for one over the other right now. You may be able to in the future. The important point here is they're all safe. Okay,
thank you. Does the J&J vaccine contain mRNA?
No, it's not an mRNA vaccine. And it contains, what it is it's called an adenovirus vaccine. So what they do is they take a human adenovirus that doesn't cause severe disease in humans. They inactivate, they cause it not to be able to reproduce inside the human, and then they put in the gene to produce the what's called the spike protein. And essentially then they give you an injection. Those viruses infect a cell, but they don't reproduce, but then in the cell, they produce the spike protein, and then your body creates a response. So it's the type of vaccine that's been used more in the past than the mRNA vaccine. So in one way, people may accept that a little bit more.
Thank you for that. Is there one vaccine that you would recommend more over another?
No, I would, from my own standpoint, if these are available in the future, I would take either one of these, any one of the three, and there'll be more coming out.
Okay, so we have several more, and thank you. This is a great discussion, everyone. Please continue with the questions. So the next question is, how are we working with community groups to provide vaccine to disproportionately affected communities of color?
Yes, and so the state is really pushing that well. They're using the SVI, which is the Social Vulnerability Index, and social vulnerability looks at race, ethnicity, economic status. It looks at 15 different points of possible inequities there. And so at the University of Michigan, the other thing we're doing is for our over 65-year-old patients, we're looking at looking at our patients in high SVI zip codes, and we're offering vaccine to those groups first. So there's a very, very concerted effort. In Washtenaw County, we have what's a low SVI SVI, Social Vulnerability Index, goes from 0 to 1. If you have a lot of vulnerability, you're a 1. The lowest vulnerability is 0. Washtenaw County is 0.2. Detroit is probably 0.8 or 0.9. So the state is using those markers, that scoring system to end up going to those areas. So it's working out. I think that's a good thing, and I think it will work out well to get to vulnerable areas.
So, just to follow up on that, so, one of my concerns is that, we have these colleges here, we have universities. I wonder how that impacts that SDI number, right? Because we do know that we have some zip codes within the Washtenaw County that are very vulnerable.
Yes.
And I want to make sure that, while we are using this SDI as a way to strategize, the vaccine distribution, that we're not forgetting these very, vulnerable groups right here in our county. So what do you think we can do to mitigate that?
Yeah, and so what we've done in Washtenaw County, our health director, Dr. Marquez, Juan Marquez, is looking at whether we can get extra doses for our lower SVI areas within Washtenaw County. So we have to look at that. And I think within Michigan Medicine, within our vaccination program, there's an active effort to look at those areas too. So we're trying. We're going to continue to try.
Well, thank you. That's good. That's on the radar. So we have 7 more. So I'm going to go through quickly. We're going to get through these. So how will it affect a Black person over the age of 60 with allergies to vaccines? What might that be?
With a history of allergies, it
yes.
says. Yeah, it should be fine. And actually, a person who is over 60 will probably have less side effects. Younger people have higher side effect rates, but the efficacy will be the same. So overall, it will be the same efficacy. The allergy doesn't matter. So the only if you've had what we call an anaphylactic or a severe allergy to this vaccine that you're going to get, then we would say you probably can't get it. But otherwise, if you've had a peanut allergy to bee stings, allergy to shrimp, all of those, you can still get the vaccine. Okay. And it's safe. They'll just watch you.
Thank you. So once you get your full dose of vaccinations, is it safe to go out for meals to restaurants?
That's a very good question. I would follow what Jennifer Granholm is doing, because she really follows the science. And she is, I'm sorry, Whitmer. Did I say Jennifer Granholm? Our Governor Whitmer. Yes, she's great, and she's following the science, and she's following Dr. J's recommendations. So, they have opened up the restaurants. I don't go to restaurants. I think you have to take your mask off, and there is still a risk. Now, if you've been vaccinated, yes, you're protected. I have to say that. But you could get infected from somebody else. You could still be up in your nose, and you could pass it to somebody in your family. So or somebody else. So to be a good steward of vaccine prevention, I think it's a good idea not to go at this time. I'm not going to the restaurants.
Thank you. Will these vaccines be an annual norm with boosters like the flu shot?
We don't know. So the answer is probably. And the question is, I think the question is this going to be yearly, or is it going to be every 1 or 2 years? right now what's going on, we're seeing some variants that are coming around. And if these variants end up being the major strains, then the companies will reformulate. For example, Pfizer and Mrna will produce other vaccines to be able to give boosters. So I think the answer to that is yes. How often we'll have to get boosters isn't clear yet.
Thank you. So another person asked that they've had both doses of the Mrna vaccine post 14 days after the second shot. Are they still able to contract the virus and spread it to others? I think I heard you say yes to both of those.
Yeah. The answer to that is we think. We don't know for sure. The studies on that are not great. There is some data coming out now that being vaccinated decreases transmission rates from you to somebody else by about 60%. It's not 100% though. So we're going to get more data on that coming up.
So this is interesting. Thank you. So do we know, I don't know if it's been discussed yet, but how safe these are long-term, and if they have long-term implications down the road that, does anyone know that, in any other country, anyone else doing these studies?
So the answer is to that, CDC is doing those studies. So they're collecting all that data. Other countries are collecting that data. Typically with vaccine research, the worst parts of vaccine side effects should come within the first 2 months. And that's why they waited 2 months before approving these vaccines. It's not like other medications that you take every day that might have effects months, years down the line, even decades down the line. These, you get them. People were concerned because the mRNA vaccine is a piece of genetic material, but it gets destroyed right away. So it doesn't get into your DNA. It doesn't change you. It doesn't even go across the placenta and get into women, into unborn children. So we can give it to our pregnant patients also. So no, I think the long-term effects we're going to follow them, but the prediction is that there won't be any.
Okay, so we're down to our last two questions, so we
Sure.
can stay on task. So there are a lot of people that have received the first dose but have not received the second dose due to delays. If these individuals are not able to receive the second dose within the time frame, will this impact have an effect on the vaccine, the first dose? How will that work?
No. So the first dose will give you some protection. We don't know exactly how much of both of the Mrna and the Pfizer. The Johnson & Johnson is just one dose to restate. You can get the second dose. The CDC says anytime afterwards, and it will be safe and it will give you the boost that you need. There are people who are in the hospital after getting their first dose. They don't have to get their second dose while they're in the hospital. They can be discharged, they can get better, and then they can get their second dose. So it's okay to delay that. They said 2 weeks and 3 weeks, but again, that we do that with other vaccines too. People who don't get them, we just get them the next time they come into clinic.
Excellent. So here's our last question, and then we'll move on to our next speaker, which will be Dr. Gerard. African Americans and Native Americans have the highest morbidity rates. That's possibly political. Do you think these populations will be prioritized? And are the Michigan medical efforts being to destigmatize the fears of these communities? What are those efforts to destigmatize fears?
Yeah, that's a huge topic. And the answer is yes, they are at increased risk. They are at increased risk of morbidity, ending up in the hospital and dying. And so we're focusing on those groups. The SVI is one way, the social vulnerability index is one way. And I've been going around to do talks because even within the hospital, folks in our environmental services, our transporters, there have been a whole bunch of groups where there's been some, what we call vaccine hesitancy, which is people who don't want to get vaccine right now. They might, and so we do have to do more education. We're doing that. We're trying to get out there. I'm trying to do talks when I can to say how good these vaccines are. So thank you for that question. We have to continue to be better at doing that, though.
Thank you so much, Dr. Cinti, for your expertise, for your time and for joining us this morning. We really appreciate you.